You know, every time I ever relied on my own effort to learn things and do things, I always stumbled over my feet though. And somehow whenever I had to, I was humbled and I surrendered and had to grow through it, that's where I gained and I grew. So I really appreciate all the wonderful things you said, Ben. Thank you. At the same time, everything really great that's really helped me has really come from above, because I couldn't have done it on my own. I tried for years. Some of you guys know me. Some of you guys are getting to know me. I've known you from before. A lot of changes have taken place in my life. And I feel like the best way to let you understand like who I've become now is just to let you know a little bit about the worst patient I've ever had in my life. This is myself. There was a time, and I know you from before, where I would go ahead and I've just learned all these healing therapies. See, in my entire life, I always just wanted to help people. At age, when I was in kindergarten, I was the one that finished doing my stuff, coloring in the lines, whatever it was, and then I'm helping the kid next to me. And that's all I ever wanted to do, was just help people. And plus with the influence of my family and stuff, my whole family's all medical doctors and lawyers and stuff, and they're like, oh, you're going to be a doctor one day, whatever. I don't know. You have different influences. But I knew I wanted to help people. That's one thing I knew. And I was pre-med, and on that path, I didn't like some of the things that I saw going on. In my entire family, everyone's medical doctors. If anyone here is from Lower Westchester, you just see the name Sage. Yes, you are. And you see all the Sage doctors everywhere. My uncle's the head of St. Joe's Hospital. But what you see going on in these circles, I felt like there's got to be a better way. Than I see people being switched from one doctor to another doctor to another doctor. And so many times people are, as you go to a doctor, you go to a place, and immediately, once you have your problems, they'll go ahead and label it for you, they'll diagnose it and start treating you, without ever helping you have some understanding or just insight as to why for 20 years or 30 years of your life or more, how do you go from being perfect blood sugar one day, and then all of a sudden now you're diabetic? So then we end up blaming it on things outside of ourselves. Because, like our age, our genetics, our heritage, our background, stress. We start feeling more and more like a victim, and that's what most of us are feeling like we can't do anything about it. And my purpose here is to empower people and to help you maybe have a little bit of insight as to what the heck could be causing that. Because if for so many years of your life you had perfect healthy arteries and circulation, perfect healthy discs and bones and joints and muscles, or a perfect healthy, hormone maintenance. If for so many years your body was able to do everything right, something's changing. And if you don't know what it is that's changing, then you're never really going to get to the root of it. And I see too many people on a path where they're getting worse and worse. And I see too many people suffer more than they have to. So, as my own worst patient, I had a situation where I was experiencing shortness of breath. Guys, when you start experiencing shortness of breath, that's when you start to realize how much you appreciate every breath. Yes. Okay? Let's take a deep breath right now. It's a great thing to do. Take a nice deep breath. Man, I appreciate that. I couldn't do that. I would go ahead, and nothing, I couldn't feel that satisfaction. I didn't feel like I was going to go into the hospital that day. I knew I was getting air in my lungs. I'm a doctor, I'm breathing. I know air's coming in and out. I know I'm absorbing some oxygen here. But I couldn't feel satisfied. And for a half hour straight, 40 minutes sometimes, I'm like, it's too humid in here. Oh, I got to do it. Just trying to fix everything. Just something, always looking outside. It's not a good thing to go through. Obviously something's going on. Something's not right. But what happened was I did the same thing that so many people do. See, it would go away after a little while, and then I didn't have it for a couple days. Then it would come back, and then it would go away. And because it would go away and come back, I'm like, that's no big deal. It was the way of thinking at that time. See, I was already a doctor at the time, and I was working with so many people. I've studied so many. I studied so much. It's such detail in the process that the body goes through to actually work and heal and repair things. I started buying all the top equipment, lasers, and just everything you could imagine, thousands and thousands of dollars. And the thing is, there's nothing on the outside that's as powerful as what you can find on the inside and what's there to guide you. But I wasn't getting people to the root to find out what's going on. And my patients loved me. And they said, Dr. Tony, you helped me so much. I don't have any Crohn's disease anymore. Thank you so much. I don't have any of the high blood pressure. But what happened was, next thing you know, 5 years later, 7 years later, some of these people that loved me, and I didn't treat their symptoms, all right? I went ahead and I allowed the body to heal naturally from the inside out. But I didn't show them how to permanently do that, how to get long-lasting results. I wasn't about finding out why it happened in the first place, because your body, you know, you started off with has anyone ever here, they'll do it? You know, you're members of the Lucky Sperm Club, I heard once. Like, in other words, billions and billions, you made it, right? You started off as one cell, okay? And as that cell, you two became one, and then one cell, and there you are out of nowhere. You have these lungs, this heart, your body's making all these tissues, and here you are today, this miracle of life. It cannot be reproduced in the chemical laboratory. All the best scientific advances and studies are based on what nature has done. Even airplanes, we see the birds and the wings, and we give them wings, and we give them, you know, everything. And the thing is, I wasn't getting to the root. I wasn't helping. See, if this power made you and flows through you, and your body has the ability to make new cells, all right? I hope that today, if your body's doing everything it's doing, it's going to be making new heart cells right now from what you're eating today. New liver cells, new artery cells, new pancreas cells. It made it completely from scratch at one point. Is that an opinion or is that a fact? You were born, you were made, you were created, you started off from, one cell and yet, and for so many years of your life, something is working in your body and keeping you healthy. And then all of a sudden, something changed there. And we need to understand what the heck is changing. And so we can get a real answer and we can do something about it. Or else, what happens is we're filled with hopelessness. Then we just start treating our symptoms. And we move into this feeling where we don't even want to think about it or look at it, because you know what's on the way, because it's a downhill slope. My brother had a stroke at age 30. Okay? When you're on this path, you never know when crisis happens, but we want people to understand what's going on. We're here not to disempower you, but you know what? Who here thinks it feels a lot better when you're feeling empowered? When patients tell me and they ask me what's going on, you know, or sometimes people ask me, what should I do? What should I do? I don't want to tell them what to do. I've been led to, as I've been molded, as I grow through my life experiences, when someone's asking me, what should I do, what should I do? I've learned that this person needs understanding. Because I can go ahead and tell them what to do, but how deep does that go? Then they find someone else with another opinion and they tell people need to make decisions for themselves, but nobody's empowering people, helping them understand what's going on. And we treat things. And that's what I was doing for myself. So I treat myself, got a little bit better, months goes by, didn't get it for like 3-4 months, then I started getting the shortness of breath again. I'm like, oh man, gotta do that again. See, but I wasn't looking for the root. I started treating it. Naturally. Some people use medicines, surgery, whatever. Some people are using natural, holistic means. All right? Because I'll tell you this, just from experience, wherever there's more life and energy in your body, that's one of the best qualities of life itself, that it's good all the time. And you know what? It'll repair tissue, and it'll repair you, and it'll save you, and it'll help you live the life you deserve. And at the same time, you know, I was going ahead and treating my symptoms and bringing things, whatever I can do to bring more energy and more life to my body. But I wasn't getting to the root, because I shouldn't have to keep doing that. And when you do that, you got to do more and more things. And even when somebody finds something that works for them, oh, this worked for me. I found out 10 years later they ended up having the surgery because they didn't get to the root. Your body's supposed to have enough energy and life flowing through it, and most people didn't understand, and I didn't even get it. You know, sometimes you can have the truth thrown at your face over and over and over again, and at the same time, you're hearing it, Charles, you know what I'm talking about, and then one day it just clicks differently.
Absolutely.
That's what happened to me. I went through this situation. It wasn't just shortness of breath. I started having stomach problems. I didn't find this out until later, but I was hemorrhaging internally and I couldn't even feel it. By the time I had blood tests done, my iron levels were undetectable. They checked it 6 times. I didn't know how could you live like that? I don't know, I said, thank God. I said, I don't know. But that's what it was. I was struggling. I was going through a hard time. My children, there was a time where I was just losing weight, another month 10 more pounds, another month 10 more pounds, another month 20 pounds. All right? I didn't know what was going on. In a way, I was afraid to look. Okay? And I just kept patching it up. How can I get by here? Let me focus on this first. See, I kept putting things off. And one of the worst things that people can do, especially when it comes to your health, is there really anything more important to you than your health?
No.
No, when you lose your health, then that's when you're willing to sacrifice everything, right, Antonio? Yeah. Just to try to get it back. And the thing is, I had this feeling like, I was feeling so proud. I could take care of this myself. I've helped so many people heal for so, and I just kept putting it off. Man, one day I went to a comedy club with my wife down in the city. One of our patients invited us. And we're down there at this place called the Comedy Cellar. Anyone ever hear of it? The Comedy Cellar, they got famous people coming in there, flying in. It's in Manhattan. And I'm there, and I'm eating the food that they have there. It's not that good, really. You know, like the chips and the dips and the, you know. And I get on my way home last night. I was feeling good. You go through your stuff. You work through it. You deal with it. Some people, they have the stomach problems, right? You take the Tums, or some people, everyone has different organs that are failing or breaking down, not doing the job that they're supposed to do, not the way they're supposed to do it. And we do whatever we can to get comfortable. And that's what I was doing. I'm like, oh, good, I'm fine. And then what happened was, we're on our way home, and in a period of about 20 minutes, I went through all of a sudden feeling this pain, to getting a lot worse, and cursing the food. I got food poisoning, I got, everything outside of me. To doing everything I could holistically. Maybe it's gallbladder, doing gallbladder flush, maybe it's my kidneys, doing kidney bleeding, and nothing was helping. To being on my hands and knees in agonizing pain, praying for my life. And I find out from doctors, I went to the medical doctors, I had some stuff tested done, and they tell me I have cancer. They tell me I have these big grapefruit-sized tumors ripping my intestines apart. Some of my patients have some pictures. You've seen Charles? It's not a pretty sight, right? And the thing is, I couldn't believe it because I feel like my whole mission in life is to help people. My whole goal I thought was noble. I'm just looking to serve. And at the same time, here I am. But I was pushing myself so hard. And sometimes you're up against a wall in life, it feels like. Believe me, when the door's bent, when it's ready and there's time, the door will be buzzed open. And it just kind of happens. And I was trying to push my way through that door. See, but it was then that I knew, as I went through this experience to transform my life, I was trying to open up the wrong door. Trying to help even more and take control of symptoms by using the wisdom of the body, the power that God put inside you, and help using it. But instead of using it, instead of allowing myself to be used, there's a difference. I was trying to push myself my way, do it my way. And what happened was I was putting so much extra pressure on myself. So much tension on my nerves. It was just over time more and more and more. My body couldn't do what it was supposed to do. There's 2 days in your life that are the most important days in your life, someone once said. And one of them is the day you're born. What's that?
I was just saying the day.
The day you find out why.
Oh.
Yeah. Because as I went through this experience, I went through such a humbling experience. I had a 3-year-old daughter asking Mommy, why is Daddy in bed all day? I was in a lot of pain. I had a lot of emotions that I went through. I was hiding from my kids sometimes. Sometimes I felt like I didn't want them to see me that way. I was scared. And at the same time, there was a part of me that said, what if I die? And let me go spend time. And I was in so much pain. I was walking along, trying to pay the bills. You can't work. Medical bills are super expensive. And not to mention the fact that if you can't work, how are you supposed to? So extra stress is adding on top of it. And then there was a transformation that happened. And I went through and found out what the heck was going on. And why. Through holistic circles, and I knew how to bring more life and energy. And yeah, there's certain spiritual principles in life, and the more you're feeling empowered, the more you're vibrating with the frequencies of love, the more, there's all these different things, the more you release negative emotions. There's all these things that help bring more energy there. But the truth is that you were created for a certain way. It's a miracle the way your body was made. There's a power in you that's doing this, and you shouldn't have to try to work with this to manipulate. If you can find out why. And that's what I realized changed my entire life, and then doors started opening. We just started serving more people, busier now than ever. But what we're doing is helping people get a real solution, a real answer as to why. Why is it that my blood pressure's not working anymore? Right, Charles? Right? Why is it? Because if things are in the body are decaying and breaking down, you better find out why. What's going to happen if you don't get to the root? My mom had a leak in her house a few months ago, and there was water stains. You could see it coming down. All right? Could you imagine? My dad would have been so pissed if she just went ahead and started painting over it and whatever. Because if there's some type of a leak, some type of faulty valve, whatever it is, the damage is just going to spread. And that's what we see to happen to so many people. And it breaks down. So things start breaking down. It's like the snowball effect. And one problem leads to another, And if you're lucky, you end up on a lot of medications for failed organ surgeries, for failed organs, because the top 3 killers in the United States are silent killers. Heart disease, all right? Cancer. I didn't even know that I had these tumors growing inside my body. So they're telling me that they got to cut my intestines from here to here, 35 years old, and I'm being told I'm going to have a bag. They're telling me that there's no way it can go away. But because I waited so long, and I lost so much weight, because as a husband I didn't want to deal with anything medical yet, I was already so thin. And they say when you start chemo, you lose about 40 or 50 pounds. There's a good chance they didn't know if I was going to make it anyway. So talk about being sick. And here I am with these 2 children. I have 3 now.
3 now.
Thank you, God, right? But praying for just to heal their daddy. That's every day that I'm walking out there. My wife tells me, I was so proud of her. I'm like, how do you see what's been? And my wife goes, Tom, she's been praying like that all day, every day. It made me cry, but it also gave me strength. Because it takes strength, especially when you let things go, when you're dummy like me. And you let things go for so long. See, when you're having symptoms, you got to know what a symptom is. A symptom means something's going on. It's not normal. And everybody can go ahead and stub their toe into the coffee table every now and then, right? You can get these symptoms, but when it's constant, when for the last 2-3 years you have something going on, when every time, over and over again, you do the same thing, and whatever that thing is just keeps causing this, there's an alarm going on. That's a fire alarm going on. Something is going on. That's why one of our patients, we just got a chance to save this person's life because we went ahead, did this test. I said, something's going on. Arteries are decaying. We got to get to the root. And he's like, thank God I'm here. He goes, everyone else just started treating me, and we helped him understand it. And then when we did a bigger picture, not only did we let him know arteries were decaying, but we saw a big, huge abdominal aneurysm, and it was about 5 centimeters big. Yeah. That's ready. And not only that, but this exact same person, was it the friends? Karen? They had a friend, mom or so, had the exact same thing, just died recently from that, because it hemorrhage of the burst. See, the top 3 killers are silent killers. You can't feel it. You can't. If you look at a men's health magazine or a women's health magazine, you know what you're going to see? Someone that looks like me. 6-pack. No. But you go ahead and you got someone that looks like 6-pack abs and stuff, right? If the way you looked right? And the way you felt was actually meant that you're healthy if you looked good and you felt good. Wouldn't all the movie stars be perfectly healthy?
Yeah.
Okay, is that really the case? No. So the thing is, people don't understand what health is, and that's a big problem in this country. We have, I don't know if you're aware of this, but we have, out of the top 37 countries, they do scans, they compare countries all the time. We rank dead last in so many things. Years of potential life lost. If you're going to have a baby in this country, you're more likely in this country than 37 of the other top countries to have the baby either die or morbidity, or to be severely ill, something happens to it. And you think, we got the best technology in the world, we got the best schools, we got the best doctors, we got this. It's the way we handling things. Dr. Tobin from Harvard University says that 90% of children, you heard of him?
Yes.
He said that 90% of children are injured even during the birth process.
Yeah.
You've heard of that? Yeah. So the point is that there's so much going on. We're number one for the wrong reasons. We're number one in cancer. More than any other country in the world, this country. Did you know that we have only 5% of the world's population? But guess how much of the drugs we use? Over 90%. We use the most, we have the most kids that are getting diagnosed with ADD, ADHD. Autism, 20 years ago, was 1 out of, I forget how many thousand, but now it's ridiculous. It's like, the number just blew up. Everyone's getting diagnosed with it. We need a change. First of all, if you're basing your health on something that's not true, is that going to serve you? No. You know how many times I did it myself. Oh, I'm good, I feel good. You know what? How you feel, can you feel cancer growing in your body? I couldn't. And I feel thankful in a way. You know, God has a way of taking bad things and using it for bad. You know, I was at a point where I didn't think I would have survived chemo anyway, because I've been so pressured, even knowing what I know. The pressure, when you lose, right now, you know, we're trying to help people while you're still in control of your life, recognize what's going on, if things are decaying, help people find out, recognize it, learn how, make your own decisions, empower you. I want to put the power back in your hands. I'm not here to tell you what to do. It means if you're not sure what to do, let's learn a little bit about how your body works. Let me show you what you need to know. I've suffered. I've been there, and I know I'm not the only one. My dad, my dad's going deaf. He's had bone loss in both ears, and he had different surgeries to kind of deal with it. But he's had other organs breaking down. My mom had issues. My grandmother, she had diabetes, heart disease, and cancer. All right. Then I have my other grandfather. I had to sit there watching him in the hospital. His lungs were filled with water, struggling for air. Maybe that's why I had to shortness of breath. Maybe I had emotional trauma from watching my grandfather go through stuff, like, who knows? But the point is that one thing I knew with certainty is that things were not doing what they were supposed to be doing in my body, and that's what health is. Health is everything doing exactly what it's supposed to be doing. So here's what you need to know. Am I the only one, by the way? Does anyone here know anyone in your family that you care about that had cancer or diabetes or heart disease? Raise your hand, let me see. Guys, show the room. Look at this. What's up with that? Is that what we were created for?
No.
No.
Absolutely not.
So there's got to be a cause, there's got to be a reason, and that's what we're doing this dinner for. Let me show you what you need to know. We're going to go quickly, and I'm going to show you what we can do. All right? But the point is, this is the real picture of health. You know why? Because that's how your body was designed to work. That's what controls everything. So who here knew that already? No, none of my patients, that your brain controls everything. And yeah?
Yes.
Okay. So the thing is that if for 20 years, right, you've been perfectly normal, blood sugar's been perfectly normal, that's because your brain has been sending signals down your spinal cord to your pancreas. Not only does it control and coordinate all function, but it renews your cells. Your body actually replaces cells about, if you're healthy, about 300 million every 60 seconds. That's amazing. You're being renewed constantly by this power that's flowing through you. And at the same time, if that power is being blocked, if there's any tension on there, if your body is not able to do that, we can go ahead and start doing types of different things. Let's say I put pressure on the nerves going to your heart, your arteries. You know what? It's not a matter of if you're going to get heart disease, it's just when you're going to get diagnosed. And if you're lucky, you'll get diagnosed. Because I don't know if you're aware of this, but heart disease, there was a patient of ours who brought a 16-year-old girl in for allergies. And he was on high blood pressure meds. And I said, hey Joe, you know what? Come on in, let's get you checked, let's see what's going on. He goes, oh no doc, I got it, I'm okay. See, his definition of health, being healthy, was wrong. His definition of being healthy was as long as my doctors say my levels are normal. So his organs are failing. It's not keeping his blood pressure normal. He's relying on drugs right now to keep him alive. He needed that. The doctors, if he stopped the drugs, no, you need to take that. You could have a stroke, heart disease. Why? Because there's so much damage. And he's going ahead. I said, Joe, we love you. And I'm pretty sure that something in your body is damaged. Well, I said, this is what I said. I said, and you guys know the answer to this question. I said, if you were really healthy and everything was fine, how many drugs would you need to be on? That's what I said to him. Exactly. And I said, well, something's going on. And he goes, I just came back from my doctor, my blood test was normal, and I could just see where his commitment was, and it wasn't in searching for the truth or looking to find the cause. It was the same thing that I did that almost killed me. Took care of his daughter. Not that long afterwards, he was at his daughter's bat mitzvah. By the way, I don't treat allergies, and her allergies were gone. We built her health up, built up the function of her immune system so that it was no longer reacting in an abnormal way to her environment. And then guess what that means to your allergies? No. So she's doing better. This is her bat mitzvah. I never knew the term before until this family. I always called it bar mitzvah. I didn't know there's a separate name for the girls. And the father was dancing on the dance floor, and all of a sudden his arm went numb. Yeah, you know what happened. He didn't make it. He never made it out of the hospital. The rest of the family comes in for care. They know that we had mentioned, because we were on them for a little bit, and I said, okay, you got to make your own decisions. But see, if you're going to just if you know things in your body are breaking down, and you don't get to the root, we love people. That's why I do this. I know why. I know what my purpose is. It's to share the truth with people. You were created to be healthy. When you start looking at this, you'll see why. He didn't have high blood pressure his whole life. So you know what? His body was doing things, replacing cells, functioning at a high level, right? And then all of a sudden, something changed in his body. It was no longer doing that. Now this is what controls it. This is what makes it happen. No one looked at that system to make sure every signal is getting through, make sure there was no damage or decay happening on the spinal cord or anything. No one checked it. They just said, oh, you have high blood pressure, here. See, to be happy, there's two things. One is your state, and that's in the present moment. Guys, what we're going to share you with is not something negative. We're going to move past this real quick because it's something positive. There's no reason for you to be sick if you're sick. All right? You have something so amazing. We're going to show you how to get to the root and make sure you live the life you deserve, what you were created for. All right? We want to empower you. The second thing is your blueprint for life, the way you believe life should be. And if you've been around through so many experiences in life, I've seen so many people, even in your family, and just go through this. If you've been so many experiences of everybody just getting sick, everybody ending up with, guys, 5 out of 6 people who are basing their health on how they look and how they feel, in this country right now die from cancer and heart disease. 5 out of 6. All right? It's sad. Anyone here, think of the last person you know who passed away in the last year or two. What did they die from?
Cancer.
What did they die from?
Heart disease.
What did they die from?
Ovarian cancer.
What did they die from? What did they die from? Thank you. Do you see what I'm talking about? We need this. We need to know there's nothing. We're putting so much faith in everything outside of us. In a pill or the next treatment. Even holistic stuff. I wasn't part of it. Believe me, I didn't know. And we're not looking inside of us because the answers are on the inside. Your body was designed in a very specific way. It's a miracle the way you were created, the way your body evolved in the uterus. And do you know after 14 days after conception, the very first thing forms, and it's your brain and spinal cord. And every other organ. What do you do for a living? I know I see you know all this stuff.
Well, this is my passion. Go ahead.
Okay, so you know this stuff, right?
Yeah.
14, and every organ, cell, and tissue in your body is formed through there. By the way, here's the other thing you need to know about symptoms. That when you're having a symptom, it's after there's already been at least 40% death, damage, or disease of an organ, cell, or tissue. Just so you know. So that's another reason why you don't want to base it on how you look or how you feel, which is why anyway, that's what society's teaching us. Oh, I feel good, you're good. Oh, take this pill, how you feeling? Good? All right, good, you're healthy. Now your arteries may be decaying, your heart's decaying, you got valves becoming faulty, but the doctors just say, oh no, you're okay. That's what his doctors told him. Now, that little girl has to grow up without a dad. I almost left my children. We're not going to let that happen just because people didn't know about this. That's what this dinner's for. It's just to spread awareness, to let you know. You know, we have people going ahead. You're new. How long have you been in my office now?
A couple of weeks, really, like 3 weeks.
3 weeks?
Yeah, 3, 4. 4?
Fairly new. Okay, right? And all we do is, did I go ahead and want to treat your symptoms, or did I want to help you understand how that happened? And so when we go in and we check people, we're actually finding where the damage is building up, where the decay is, and teaching you how to take proper spinal hygiene, how to proper care of it. Because every single human being, every person here goes through times in your life where you feel doubt. I'm going to show you, I want you to understand how this happens. You have fears, you have worries. We all go through this. We push ourselves. We do different things. Everybody goes through this. There's nobody that I know of, except for one person I can think of in my mind, that walked perfectly without ever having any doubts, fears, or worries. Okay? And then the point is that, so we fall down. Did you know the average kid, by the time you're age 2, falls about like 500 times? 5 or 6 severe falls. And most moms and dads never knew to get their kids' spinal cord checked. Now you can't feel this stuff. Christopher Reeve broke the freaking bone. He had pressure on his spinal cord. He died 7 years later. It was killing him. There's a lot of people I know that are dying, they don't even realize if your organs are failing, that's what's going on. And for him, his lungs stopped working and they hooked him up to a respirator. His intestines stopped working, they had to literally have to push him his intestines, get him to go through a bag. His heart stopped working right, they got him a pacemaker. He had to have a tube to urinate in a pail. He couldn't move. He was dying. And 7 years later, he died. And he gave the most inspirational talk. Because there's spiritual laws in life, and yes, you want to be inspired and live a life of purpose and passion and serve. But the point is that there's also physical laws in life. And if I chop someone's spinal cord, or if I shut down someone's brain, you're gonna die. That's it. It means you're done. Your body can't live. Or if we cut direct nerves to a vital organ like your heart, you can't survive. And so many people, as you go through these deaths, fears, and worries, you get this tension built up on your nerves. Now that's normal, that's okay, that's how we were designed, lets you know you're alive, you know? If I have something that stresses me out, the tension's there, it's letting me know I gotta focus on this. I gotta pay more attention. Gotta make sure things go whatever way we want it to go, right? But what happens is when you leave, when you're either, you have enough faith in yourself, you're working towards a solution, you overcome it, that tension goes away. Or you decide it's not worth it, you focus on something else, that tension goes away. But there's a chance every single time, if it was too much, if it overwhelmed you, if it was too long, guess what happens? It becomes a subluxation. That means that even when you're not focusing on it, what stressed you out, that pressure stayed there. Your nerve got conditioned with tension. And that's not even the worst part, because that'll stay with you for the rest of your life if you don't know how to properly take care of your spinal cord. We're teaching children now how to do that. Our families are coming in, and they're just like you teach them how to brush their teeth, they're learning how to take proper care of it. They know that they go through their stresses, but there's nothing more important other than, for me, in my own personal relationship, I tell them that your faith is the most important thing, and next comes your health. Then your family. And then your mission to help others. I used to put my mission to help others above my health. I had my priorities off. So this tension, it's not just that it stays. Every day there's more tensions building up. More and more and more. Then muscles get tight, and you go through different phases of decay and damage. And this is just a medical chart showing you that what actually happens, because you start to lose that curve. And what I really want you to take note of today, just one thing simple, that when you lose the normal curves in your spine, look at the shape of the spinal cord inside the canal compared to this one. Do you see a difference?
Yes.
That's what you need to know. Because as that tension builds up, if you don't properly take proper care of your spinal cord, which we want to teach you, everyone needs to know this. If you don't take proper care of it, it builds worse and worse and worse. We go ahead, we take x-rays of people, and it's horrific what we see, how much decay and damage is building up. Sometimes it's just due to grace that they're even still alive. You know? You have medicines. When your organs are failing and things are breaking down, you can go ahead and start trying to control everything with drugs. Let's control your blood pressure, let's control this, let's control that. But you'll never do as good a job as the power that made you doing it in the first place. And also, those cells need to be replaced every so often. There's no drug in the world that can make new healthy cells for you. So eventually, it's just a loser's game. And those organs will continue to decay. So many people are going through this. So many people are dying every day because of this. And the thing is, they got everything they need inside them. It's not that hard. You just got to look for the cause first. You got to just say, okay, I know my body made perfect, healthy organs. What's it not doing that it used to do? That's all you got to say. It's that simple. And if you start seeing damage building up on your spinal cord, you know that's your lifeline, that's what's keeping you alive, then you better fix it. And if you don't know how, you better learn. Because what's going to happen if you don't? How many people was it again? You don't have to all raise your hands again. Okay? Do you see? So we're here to save lives. We're here, even if someone went ahead and started to take some pressure off their nerves, do you realize you're adding years to their life before something happens? And if you go ahead and you learn how to do it right, you're going to just change your whole life. Agnes is a patient who was on so many medications. And she was one of those people, she was conditioned with this old blueprint. Everyone gets sick anyway, so I'm happy with what I'm doing. That's okay, but she had a bad blueprint. And I can't stand it when people are disempowering people and telling you that's just normal. Let me tell you something, disease is common, but it's not normal. It's not normal to be sick. That's why it's called sick. And you can't feel sickness. Most people are sick, you can't even feel it. They're walking down the street, they look like, I was looking perfectly normal. So the point is that we all need to get this checked. Because if you don't, and you don't learn how to take proper care of your spinal cord, there's not one person that doesn't go through these doubts and stresses. There's not one person who doesn't need to take proper care of the spinal cord. And that's what we're here to do today. We're here to help. We're just giving the basics. But the point is, if there's something going on, you can change your whole life. We're transforming families, one family at a time. The beautiful thing about it, what made me so spiritual, even more than ever, is because we're just looking at the design, and I realized that when you just support it and you get things back, my spinal cord was bent backwards. And the amount of decay and damage on the actual bones, you can see like the bones were changing shape. My discs were rotting. And I'm 35, the doctor told me I had a 70-year-old spine. And my spinal cord was kinked backwards. Now this is the vital organ that's keeping me alive. I couldn't feel it. Just like Christopher Reeve, he spoke at my high school graduation. His organs were failing. He died within 7 years, and he didn't feel it. There's a guy, Dennis Bird. Does anyone know who Dennis Bird is? Famous football player in New York Jets? Who? You do? Dennis Bird had a similar injury on the football field. Went to tackle someone, boom, broke his neck. Paralyzed from the neck down. Told it was going to be the same outcome as Christopher Reeve. But they, instead of pinning it and keeping it perfect subluxation, they made sure specifically with a huge influence that they wanted everything to be off there. They knew about the curves in the spine. They wanted to make sure if you do any surgery, we want to maintain this pressure. We want the spinal cord to be relaxed and easy so life can flow through, and they demanded it. When they followed the guy, he wrote it, there's a book that Dennis Bird wrote called Rise and Walk, the Dennis Bird Story. You can read it. And he talks about how his trainer went ahead and he had this principled chiropractic mindset, and he went ahead and cradled his neck for 8 hours, carried him onto the whatever that thing's called, and they brought it into the elevator, into the ambulance, and brought him to the hospital, cradled his neck for 8 hours, making sure pressure was off that brainstem. Because this is what's keeping you alive. And within 3 months, yeah, steps like this, and right now you would never even know anything was wrong with him. And he's around preaching about how God healed him all around the country, yeah,
When it
around the
happened,
world.
they said he was going to die that day. I was watching the game.
I watched the game too. I was just
Yeah,
there.
they said
That's probably why I got all the cancer and all the stress.
Just watch it.
You know what I mean? So the point is that it's the difference between life and death. And the thing is, you can't feel it. And so many people have this stuff just breaking down. So guess what? Who here already knows that you have some stuff going on? Like maybe you're getting the headaches, or you do have the back pains. Okay? Or maybe you're on medications. Go ahead, raise your hand. Show the room. You see? It's pretty much everyone. Okay? We're not going to let that happen. We're going to do whatever we can to help you find the root. We're going to help you get to the cause, to help you understand if anything's decaying and damaging it. We need to show you exactly why things are breaking down and show you what you can do about it. And if you're in a window where, like, what can be done? And how? And you got it? So we're doing special, what we're doing today, for what we're doing, we started doing these dinners. We're having another one in 2 weeks, first of all. And I'm praying that anyone that you love and care about, you invite them to the dinner. Because we're going to do the same dinner. And right now we're just going to come, enjoy your meal, enjoy yourselves, it's over, that's it. But this truth needed to be shared because it's going to change your life. So the point is that for the test, I don't know if you're aware of this, but the type of technology that it takes to measure what's going through there, we compare it against MRIs and even surgery, because when a surgeon opens you up and looks at the nerve, you still can't see the life that's flowing through there. We have that technology, it's very expensive, but this is our mission in life. So we're blessing everyone. That's what we do. There's no other places doing this. Okay? For $40, we're going to make it available not just for you, but for everyone in your entire family if you want to get checked and see exactly what's going on with your spinal cord and if it's okay. There's certain arcs and rules that we want to teach you, let you understand how to know. There's just basic rules and laws of life that let you know if your spinal cord is going to decay or not. Especially if you have tall children. You got to make sure that they're watching their posture. We'll teach you exactly what to look for. You got to make sure that they're safe. If your child doesn't know how to take proper care of the spinal cord, you're handicapping them. Research shows in America, only 1 out of 1,000 make it to age 60 healthy. And for couples, and I hope that they get to find the love of their life and grow up together in healthy relationship, healthy life, only 1 out of 10,000 make it to age 60 healthy. Couples, yeah. It's horrible. And yet, the beautiful thing is that every single time, there's only one power that made you, one power that heals you. And you got to make sure that power is flowing through without any interference. And we have the technology, we have the test to do it. So, that's what this is about. We're here to spread that word. You were created to be healthy. We want to make it available as easy as possible to everyone in your family. We want you to be able to get checked. Okay, Antonio? All right? If we already know things are breaking down, what are we going to wait for? For a crisis? When you have a crisis, you lose control. And even me, they were putting so much pressure, I almost went ahead and went through all the stuff. But I started working to fixing that, and the tumors went away. That's a miracle. The doctors would tell me they would never go away. They called my father up. They called my father and said, your son needs to, and they started, I told you that I know all the doctors, and they just called him up and they basically told him in a nice way that I was going to die if I didn't do it. But you know what? Because I went through that period, and I said, where am I going to put my faith? And I just said, you know what? And I just committed 100%. I remember the day I felt a transformation take place in my heart. And I committed to making sure that 100% life can get through, and it's made all the difference for me. Not only has it blessed my health, it's blessed my practice, it's blessed every area of your life. Have you noticed changes in the other areas of your life too? When you start vibrating with that level of peace and vitality, when you put that first in your life, making sure that power is flowing through you, it changes your entire life. So the last thing I'm going to ask you today, this is a mission to reach others and share the message. And if anyone, even if they're in another state, it doesn't matter. I'd love to call, give a second opinion to someone, maybe a consult over the phone. I've done that for people, and I've helped them. I just helped someone in Vermont recently. Someone who, her daughter said, oh, my mom's just so whatever, and I just talked to her. And, it's just, all of a sudden something shifted for her. And I can't believe this woman. She was age 16 years old. Doctors were just telling her what's wrong with her. They've been treating her and keeping her alive for so many years. And then now, all of a sudden, everything took a turn for the worse. That's why her daughter was scared to death. And she goes, you need to do something. And I'm like, I can't do something, but I can hear. You know what? Let me just give her a consult and help open her up and see what's going on. And then all of a sudden she's like, where can I find a doctor like that around here? And it's just so we're starting to do something. It's not about our office, it's about the mission, to help people learn and realize, just by recognizing and starting to believe that you were meant for more than just to get sick, changes everything. So Agnes, I'm going to finish that story, who came in, and she was on so many medications, and she had blood pressure issues, and she started losing the ability, her clarity of mind, because she was on so many meds, and she couldn't live on her own. And that's what scared her. She didn't care about all the organs. She didn't know she was older. But the thing is, she's not with us today. She died at 87, okay? But when she died, she was clear. She was off her medication for years already. She was living the life that she was on her own, living on her own. And her daughter called and let us know that she had just spoken to her mom a few hours right before, that her mom was just hanging out on the couch, and that she was happy, and that she nodded off peacefully in her sleep. And I said to her, we can all miss Agnes, but you know what? That's how it's supposed to be. Not supposed to be battling cancer, sticking poisons in your body, suffering, amputating parts. So no one needs to do that. And in front of me, I'm not going to let that happen to anyone in front of me. So when we go ahead, we don't just treat symptoms. We help you go step by step. We're not even offering to treat anything. What we need to do is just check and make sure that's not happening. Okay? And like I said, it's for your entire family. We'll help you guys, and we'll make sure everyone gets checked, okay? Do you guys have any questions? Yes?
Lifelines.
Lifelines. So the lifelines that you see in front of you are, we're going to go ahead and in 2 weeks, we're going to have a bigger dinner. All right? I can't make it bigger on my own. If you guys, do you think this was valuable information? Yes. Okay? It's simple yet valuable, right? See, the truth isn't always easy, but it is simple. Okay? And the thing is that we want to try to get this whole room filled in 2 weeks. The purpose, I just came back from a vacation, and I said, I put it to God's hand, I said, you know what, let's just get out there, let's just do this, see who comes up, and I know that we can make this a huge difference. With your help, I know we can make a huge difference in your families. Instead of 5 out of 6 people ending with cancer, did you know only 2%, 2 to 4% are truly genetic? See, if it was really your genetics, you'd probably be born with it, then you have an argument for it. But when you had the same genes your whole life, you had perfect blood pressure, perfect heart circulation, perfect, you know, and then all of a sudden something changed. Was it your genetics that changed? No. You better, but there's laws that are being broken, and if you have more strain on your body than it can handle, not enough life flowing through, of course it's going to break down. It's not like, oh my God, I can't believe this happened to me. Let's make sure we empower ourselves. Let's look at what's going on, see if things are breaking down, and turn it around. And everyone you know, just take a minute to whoever you want. We're just going to do the exact same thing today. Maybe it comes out a little different, I don't know, but the message is, you know, that when Spirit just kind of flows through you, but that's what it is. And I know that we can change lives, we can change our families, that we can change the outcome. We don't have to see so many, like I said before, if we're lucky we end up on medications and surgeries for failed organs and decayed spines. That's because sometimes, like I said, my brother had a stroke at age 30. I know a friend who died at age 33. All right, I've seen enough of this, and I don't want that to happen anymore. So take some time now while we go ahead. We're going to bring the food out. Janetta, tell them to bring the food. And I want you just to enjoy your meal. I want you to know one thing, that you were made to be healthy, that the power inside you, its one job is to love you. Every time we ever let more life and energy flow through each things start repairing. But if you're just trying to do it outside in, you get temporary. We're going to show you how to make sure, where is it, your spinal cord being choked off, where's the decaying damage happening, and show you how to take better care of it, so you can have it for the rest of your life, till your last breath. Okay? All right. God bless you. I just want to thank everyone for this time to come out with me. I just want to thank God for this meal and the people to share it with, and I just pray that we all live the life of our dreams. Thank you.